Good evening, everybody. Yes, welcome on in to another episode of Medical Talk in Layman's Terms with Nurse Charlene. And tonight's topic is something juicy for you and stuff. You're going to find out tonight if you've never heard of it and stuff. And that is autoimmune disease, when the body attacks itself. That's what it means. So I'm gonna give you all those details and everything pretty soon. Y'all come on in and everything. Before I get all the way into it and stuff, I want to make sure that I read my podcast disclaimer, which I will be doing in about a few seconds and stuff. But the most part, I welcome you guys on in. I'm doing this medical podcast because it's something that's absolutely needed for us. And we tend to want to know what medical stuff. I'm putting somebody else on, so please forgive me. But we tend to want somebody to know what we're doing and stuff, but it doesn't always work out that way, and it causes some trouble. Here you go, Mom. That's my mommy. She is okay and here with me, loving me. But yes, for the most part, it's needed because you always want to know, and then you think, sometimes, yeah, the nurse might know and everything and stuff. I got a nurse in my family, I got two, I got a doctor in my family, but sometimes they're not always mentally available for you. So you got to know how to get in there and get this stuff done for yourself. And the biggest thing that I found just talking to people, just trying to see, so that's when I make up all of this stuff is I tend to talk to people about like, hey, I want to know why, what be happening to make people like not want to go to the doctor, not trust them, or something like that, or not feel like I'm not going to the doctor, because they always got bad news. Well, if something wrong with you all the time, then maybe you should know about bad news, because guess what? The bad news can get badder by 10, 20, 100 fold, meaning, I didn't go to the doctor because they nosy, first of all. They want to know who else in my family got diabetes and stuff. That ain't none of their business, and stuff. And I'm reporting on somebody, no. If you don't tell them, how do they get to know you? How do they know what's running in your family? How do they know what happened to you, and everything? So then what ends up happening is you don't want to know because you don't want to hear the bad news. And then guess what? You faith around and find out, because what ends up happening is now it's at the end stage. It's inoperable. There's nothing else we could do. Then they give you a timeline of when you get to die. Yeah, that doesn't sound positive. That doesn't sound like what you want to hear, or deal with and everything and stuff. So welcome on in, Rosetta Granny Allen. That's my mom, and she's in here. That's one of my number one cheerleaders and the biggest patient I've ever had in my 21 going on 22 years this year. Yes. All right. And stuff. But the whole point is, if you don't find out, you don't find out, and then you just drop dead of something. And they're not going to know that you got, this or that, and stuff. They need to know by actually seeing you. You got to make those doctor's appointments. You got to get in there. You got to do these things and stuff, or it's all for nothing. I don't even care about Obamacare or Medicare or WellCare or Medi-Cal, or I could care less. Get in there and use it. It's there because people get sick. Even if you ignore it, you still got it. Like, okay, say I got AIDS or something like that and stuff. If I ignore it and never go to the doctor, I'm just not diagnosed by a doctor. I still got it, and it's still gonna drag me, and stuff. So when I'm saying this and stuff, I'm saying whatever it might be that you got. If you don't find out just because you don't want to hear it, yeah, that don't mean that it ain't gonna drag you. It's not gonna tear you down. It's not gonna take your life, and stuff like that. So you might as well find it, because you'll be surprised. You got a running chance Somebody else had it too, and somebody else had it too, but they went to the doctor. So they found out, and even if it's an ugly, grueling recovery or whatever and stuff, at least you know, and instead of just dropping, and stuff like that. So that's why I'm on here. What I'm doing is trying to pull it together and find the puzzle pieces. I haven't found the magic, and everything and stuff. But I'll tell you one thing, there is one magic, and that's called your body's a snitch, believe it. And if that tag doesn't ring true, you got to sit there and play with it for a minute and just really figure out what that means. Look it up and stuff. What does a snitch mean? It means a tattletale. So your body has a tattletale, one that's not, scared to tell it all, but it tells it in things like symptoms, like a fever. Oh, you might have an infection, dizziness and blurred vision. Oh, you might have high blood pressure. A slurred speech and a slurred mouth and your mouth drooping and everything and stuff. Oh, you might be having a stroke or something, or you might not, but what you gonna do, and stuff. So as I get along and dive along and stuff, this is what I'm talking about and stuff. It's crazy, but it's the doggone truth and everything. So before I get started and tell you about my little board in the back and everything, I'm going to go ahead and read the podcast disclaimer so I can dive on in and everything. Welcome on in, Antoinette Bell. That's my cousin. Hey, she said, I'm here. It's Tony. Hi, everybody. She's saying hi to everybody out there in social media land and beyond. And hey, Miss Maria, my other cousin and stuff, she said, hey, lady, hey, sweetie and stuff. Thank you guys for coming on. I appreciate you. And we're talking about autoimmune disease. Y'all gonna get a treat tonight. Oh my God, it's a treat, because the darndest thing that is considered an autoimmune disease and stuff, wow. Let me get this podcast disclaimer out the way. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. If you have questions about a medical condition, reach out to a qualified healthcare professional, your doctor, instead. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Guest views are their own and may not reflect the views of the host or this podcast. The information shared is for general knowledge. That's what I meant to say. It is not. It should not be used for any legal or medical purposes. Okay, I'm gonna leave that part alone. Medical purposes and everything and stuff. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. And guys, stay informed, but always seek professional medical advice when it comes to your health. It is a matter of life and death. Y'all welcome on in. I see Pastor Carol on here. She said it's helping inform people to help save lives. It absolutely has done and been doing that exact thing every time and stuff. So you'll be surprised. The people that don't want to come on, y'all got to just be their voice for them. Ask those questions that they would ask, but they're afraid, and everything. Like they're afraid to go to the doctor. But just one thing that you might ask might push them over the edge, and they go to the doctor and find out that they're completely healthy, or find out that they're not healthy and they got a couple things wrong, but there's hope for them. So instead of them feeling doomed and then getting to that stage, the end stage, we can do nothing more for them. You got this much time to live and stuff. You might be able to change that dynamic. And that's everything. And then Maria said, what? Uncle Ricky said, hi, Bubbles. Y'all, that's my nickname and stuff. Only a couple choice people get to call me Bubbles and stuff. But yeah, and stuff. I'm not going to tell you why they call me Bubbles. Okay, I will, but one day. and everything. But yes, thank you, Maria, and stuff. So tonight's topic is called autoimmune disease, and it's basically when the body attacks itself. Okay, so my body is not only gonna snitch on me, but it's gonna kick my butt anyway. Yeah, yep, that's what it do. Okay, you want to know what it is? Let's go on in. So we're gonna do a little medical terminology. Terminology. Auto means self, yourself, and immune is your immune system. You know, like you get immunity or vitamin C. What is it? Emergency. You know that stuff and everything when you get a cold and stuff. So that's your immune system. It's your protection. Your body protects you from things that it says like it. Your body doesn't like a cold. It doesn't like some type of infection. It doesn't like the flu and all these other things that you can get. It's so many things you can get and stuff. So what it does is when it sees a foreign invader, like a bloodborne, you know, you have infection in your blood or sepsis, you know, or you heard of those things and stuff like that, or whatever it is, it goes to protect you. Even when you get like these little COVID vaccines that they got out now and stuff, the reason why it hurts so bad is because your body, your immune system went to it after they shot it in you. And then a few hours later, you feel like your arm gonna fall off and you're gonna die and stuff. It's a reason behind that and stuff. Yes, Pastor Carol, she said lupus is one of those diseases. Yep, I'm gonna dive right on in. Yeah, I got it all down here and everything. But yes, exactly. And you'll be surprised after I start giving you the definition of what that is. So what I'm saying is it means when the body attacks itself, because auto is yourself and immune is your immune system attacking itself instead of protecting you because it doesn't know what it is. Why you got that? You know, and so it's gonna go beat some butt. You know, it's an enforcer. Okay. So behind me real quick and stuff, before we get all the way in and stuff, I got a person, and then I got all this stuff. You might not be able to see it that good, but what I did was I tried to give you all the different things, you know, like it's a person right here with this right here, which is a mask, but it's actually a disease, autoimmune disease. And then also you have your thyroid is right here in your neck, where a man's Adam apple would be and stuff like that. But everybody's thyroid is right there. And if you get a certain one of these autoimmune diseases, it'll swell up. I'm going to tell you about a few just so you get some examples of it and everything and stuff. But that's what that's all about and stuff. Then you got your foot right here, your knee right here, and different parts of your body and stuff, you know, with these little red patches and everything. That's actually an autoimmune disease. So you see where I'm going and going and going and everything and stuff. So that's what I'm going to be getting into tonight. It's cold. It's cold because I've did this one before in the past, but it's been so long that it doesn't hurt to come revisit some of them and everything. But what is an autoimmune disease? An autoimmune disease happens when the body's immune system, which is supposed to protect you from germs, mistakenly attacks healthy cells, tissue, or organs. Cells or tissue or organs. And everything you'll understand as I go along. In simple terms or layman's terms, the body gets confused and fights itself. It don't mean to do it. It's just confused because it can't tell, but I don't think it should be there. So I should go get it, you know, and stuff like that. That's what it's trying to say and everything and stuff. So it's usually that bad. The immune system can attack your immune system. The body's immune system or protector can attack these things: joints, skin, organs like your thyroid in your neck and stuff, your kidneys, that's the cleaners to help you go pee, you know, and stuff like that. Intestines, that's a part of your digestive system. No intestines, no boo boo. Yeah, they play a pivotal part in you living and being alive. The brain. You mean to tell me it's going to attack my own brain? That's your think tank. It's going to attack that. No. Okay. So you see what I'm saying? And it also attacks nerves. Okay. So you see, those are the things that your immune system is capable of attacking. So if it senses something ain't supposed to be there and it's not sure what it is, it's going to whoop it. It's going to, as simple as that. And I'm trying to keep it in layman's terms so that everybody gets a little piece of this and they can walk away with something and everything. And then this is a fun fact. There are more than 100 known autoimmune diseases, and many people have more than one of these at the same time. You mean to tell me I can have lupus and this, or this and this, or this and this, and stuff, more than one? So that means more than two, and stuff, and say more than one and everything. So that's a big deal. Why do autoimmune diseases happen? Okay, let me give you some causes. There is no single cause of an autoimmune disease except for having a human body. But most experts agree that it's a combination of factors. Number one, meaning genetics. It's in your genes, they run in your family. Okay, I'm just saying that's one of the reasons why you can have one of these and everything. So one is it runs in families. You may inherit the tendency, but not the disease itself. So you can get, you could get this, but not get all of this, and everything. It's like almost, I don't know if anybody knows about this disease called sickle cell disease and everything. It's mostly prevalent in the African American, or Black families and stuff like that. But you could come down with the trait, which is not the actual disease itself, or you can come down with the actual sickle cell, and that's a cold-blooded thing. Pastor Carol, you know about that and everything. So she doesn't have it. She knows about sickle cell disease. Sorry about that. I have to make sure I'm being a little bit more clear and everything. Cousin Tony said, yeah, our body is stronger than we know. And it's always fighting to keep us healthy. Absolutely. That's his main job, is to fight to try to protect you. So when it sees something and it's weird a little bit, it's like, what is that? I'm going to go tear it up. That's what I am going to do. And stuff. Everything else, I help the body out any other time and stuff. I'm going to go tear that up. I don't know what that is. Like the COVID vaccine or something, and stuff. So that's why I feel like you had a war in your arm, because it's going to attack that. But look, when people, I ain't putting that in there, I'm going to grow a donkey, but and all of that, and all of it. Yeah, it changed your DNA. Why? Well, maybe you need your DNA change. What I'm trying to say is if you don't get it and stuff, your body doesn't remember. And then when you get COVID again and you ain't had the actual vaccines and stuff like that, guess what? It terrorizes you for at least a couple days and stuff. And you better hope it don't kill you, because it has killed millions and everything. So Pastor Carol said, right, my eldest godson, that's why I said you might know and stuff. Your eldest godson lives with that. Absolutely. And he had a hard knock life growing up and everything and stuff, because it ain't no joke. It's a real grown disease, but it attacks you even as a child. It doesn't even give you a chance to breathe good. And it's called the sickle cell disease. Yes. Thank you, Pastor Carol and stuff. So then what else did I want to say? So genetics, that's number one. Another cause is hormones. Because women are affected 2 to 4 times more than men, It's because of the hormones in our body. Men secrete testosterone for men, that's their male hormone, and for us it's called estrogen. And estrogen plays a role in more women getting autoimmune diseases than men, but we both can get it. We're human beings. Okay. The number three one is environmental triggers. Environment means what's around you when you go outside, when you go to work, your environment, wherever you are, it doesn't matter and stuff. If you at the gym and you work at the gym, it's at the gym, it's at the school, it's at the hospital, it's at the so whatever and stuff. But that's the whole point of that and stuff. So environmental triggers will be infections, viral or bacterial infections. That will be our flus and some of our, you know, bronchial problems and stuff like that. Just infections, period, and stuff. And sometimes they get in your blood and then they cause a whole nother game to jump off and stuff. But infections are one of our environmental triggers because we catch the cold from somebody else, most likely, or we just catch it from being out in the environment and not bundling up, or you know, having too many clothes on and sweating and stuff like that, and things come down. We come down with things. Also, stress. Well, you know, since I don't stress, I probably won't catch nothing. If you're a human being, if you haven't been through any stress, something wrong with you. Yep, something wrong with you. Okay, so it can be physical stress or emotional stress. Either way is stress. And then there's trauma. Anybody that hasn't had a traumatic event of some sort and stuff, okay, kudos to you. But for the rest of us actual human beings and stuff like that, we've probably experienced, depending on your age, a trauma sometime in our life of some sort. It doesn't matter what it is and stuff. It's not a one size fits all and stuff. It's just trauma. Was your trauma might not be the same kind of trauma I go through, you know, and stuff, but it's trauma. And then there's also exposure to chemicals or toxins. And I use this as an example. If you're a janitor, you have that stuff that you know, mop the floors with or clean off the desk at a school or something. If you're the school janitor or something like that, you're dealing with chemicals, different chemicals. You might have to pour something in the toilets or something like that, and you clean around the toilets and all of that stuff, and then water splashing around them chemicals and everything. And one time you didn't have your gloves on and stuff. That's all it takes, you know, to try to get in, and then that build up over years and years and stuff. But also, if you're a car washer, like a detail place where you go get your car washed, they're dealing with tire shine. That's a chemical that goes on your tires, not on your fingers. That's tires and stuff. They go on the actual tires, so that you see the chemicals and stuff. So that soap that's innocent, it's all pink and yellow. Ooh, it's so pretty and stuff. Yeah, it's so pretty and deadly and stuff. But that's where that comes from. Pastor Carol said something. Can Parkinson's disease be considered too because it affects your nervous system with tremors? I'm not sure. I didn't see Parkinson's disease as one of them and everything and stuff, but I will definitely make sure that I answer that question for you after the live is over and stuff. I'll give you a detail. So go back and look for that and stuff. That's an excellent question. Thank you, Carol. And stuff. So then what else? I said environmental triggers, lifestyle triggers, poor sleep. I know I get all my sleep all the time and stuff. I never miss a hour or two or three or four or five and stuff. You know me and stuff. Okay. And then chronic stress. You know, I never stress. I don't know about y'all, but I don't never stress. Okay. You know, I'm make believing and stuff. Maybe if I say it, it'll happen. Ain't that positive thinking? If I say that I never stress, then I shouldn't be stressed. I wonder who told the stress that, because yeah, it'd be getting me and stuff. And then smoking, And you know what? I brought up, I was talking to my mother earlier and stuff about the smoking part and stuff. But you notice on TV, we used to have All in the Family and the Jeffersons, and we had Good Times and all of that stuff. And further back than that and stuff, look how long it's been since you seen somebody smoking a cigarette and it's cool, and stuff. We might see Snoop Dogg smoking a blunt. He probably don't even do that no more. I haven't seen him in a long time, in years, do that. But I'm saying it's not popular because somebody must have messed around and found out they body snitched and stuff, because they found out that the cigarettes is not gonna do you, and everything. And for anybody, this is non-judgmental, but if you are, a smoker or something, you probably want to consider stopping, because you're gonna faith around and find out, because it is what it is. Even if I like smoking cigarettes and stuff, it is what it is. That's all I'm gonna tell you. And it's a lot of chemicals in cigarettes. That's why they call it, the lung cancer of, cancers and stuff like that, is cigarette smoking, because a lot of people end up with cancer from that, lung cancer to be exact, COPD and all of that type of stuff. Okay. So another one is your diet, and so it's this the lifestyle part of it, or causes of autoimmune disease. So one of the big ones is diet and gut health. Do you know you have to have healthy bad bacteria and good bacteria lurking around inside your body, inside your digestive system, in your gut. Your gut is your GI system, gastrointestinal system. And so if you don't have a good mixture of good and bad, that's the difference between diarrhea or constipation. Sometimes that's the difference between irritable bowel syndrome and all these other things and stuff like that. It's a whole bunch of stuff that can go wrong in your gut. And guess what? Most of us that's even on the line right now has already found out that it's a problem and everything. And that's where that comes from and everything. Who's at risk of getting an autoimmune disease? That would be women, especially the ages of 15 to 50 on up. 15 to 50, you gonna mess around and find out. I'm a leap year, so I'm not counting. I don't recognize those other years in between and stuff. So I'm not 15 yet. So I'm just gonna do that. I'm trying to do positive thinking. It's probably not gonna work, but yeah, no, I found out already. Okay. Also, who's at risk? Family history of autoimmune disease. Remember, I told you it's over 100 plus known autoimmune disease, meaning there's some that's unknown yet. They're still studying it, because we come up with stuff all the time, because there's all these humans everywhere. Welcome on in, Miss Liddell and stuff. Thanks for coming on, my dear. Yes, we're talking about autoimmune diseases. And autoimmune disease means it's when the body attacks itself. Pastor Carol talking about I play too much. I don't be playing too much, but I do want to see if I can catch you slipping, though, and everything. Welcome on Aquaria. That's my little sister from way back in the days. We was babies together and stuff. Bless your heart and stuff. I'm doing my medical talk in layman's terms with Nurse Charlene. And tonight's topic, we're talking about autoimmune disease. And I just basically break down any kind of disease process, illnesses, and everything of your entire body, mental health, physical health, and everything. And then I put it in layman terms for, everybody to understand. Welcome on in, Sandra. Everybody wish Miss Sandra luck. She just had surgery. It was successful. And now she's in her recovery phase, her rehab stage and everything. I wish you luck. I send out prayers for you and everything else and stuff. God bless you. She said, good evening, Nurse Charlene, Rosie, and Britt, listening from my hospital bed. Yes. But she gets out of the bed and she gets up walking and stuff, because she just had surgery and everything. But bless your heart. thank you for coming on. And it's okay. You know, make sure if you miss something that you catch it on the next one and everything. Oh, Aquarius said, hey, beautiful. You too and stuff, beautiful lady and stuff. Thank you for coming on, my dear. And oh, Carol, Pastor Carol is on the line, and so she said, Aquarium Malvo. I just seen your mom. Oh, you just seen her mom. And you know, Sandra, Miss Sandra, yes, yes. See, this is a whole family reunion. That's what I'm talking about. All right. And stuff. This is awesome. Yeah. Thank you, Pastor Carol and Aquaria and stuff. So moving on to the top 7 most common autoimmune diseases. I took a couple out and stuff, and I'm gonna replace them with some extra stuff that I did because I want you to get to the good part and stuff, you know, things that hit, you know, close to you and everything and stuff. So the first one I want to talk about, nobody gonna believe me. It's called rheumatoid arthritis. Everybody know what arthritis is, but this one is called rheumatoid arthritis. That's one of the main, most common autoimmune diseases when the body attacks itself. So the definition of rheumatoid arthritis, or RA, is a disease where the immune system attacks the joints, causing pain, swelling, and damage. Oh my goodness. That's special and stuff. I think everybody then felt a little pain, but this one is cold because it lingers and lingers and drags you, and you just miserable, ready to fight it. But it's fighting you already. It got a battle going on inside you because it's attacking itself inside the joints and everything. The age group most common is 30 to 60 years old. 30, young and tender 30s to 60-year-olds and everything, and above, of course. And then it's more common in women than men, but it's more common in human beings, period. And you know, pets actually get it, dogs and stuff like that. They get the same thing we get and stuff, but I just thought I'd throw that in there and stuff. Symptoms, so that you know what it is. Rosie Grandy Allen said, teach, nurse, teach. My, amen. Amen, Rosie, I'll teach. Cousin Tony said, yeah, I'm going through it with this arthritis. Yes, and everything. Just remember, if it's always inflamed, and well, I'm going to give you the symptoms now and everything and stuff. So listen to this, Cousin Tony. And Carol said, yes, girl. I think she was talking to Sandra and stuff, but if not and stuff, yes, let's go on and get on to it. And that's the symptoms. Joint pain. Arthro, it means pain, joint, and itis means inflammation. So arthritis, the inflammation of the joint. Y'all see where I'm getting with this? It ain't that hard and stuff. I'm gonna make you guys doctors and nurses and doctors after a while and everything. So Antoinette said, okay, I'm listening, cuz okay. So the first symptom of rheumatoid arthritis, which is an autoimmune disease, arthritis period is just a problem and stuff, is joint pain and swelling. That means it actually swells up. So just pay attention to this, because this is something you're going to have to probably talk to your doctor about. But that's the pain and swelling in joints. But where is our joints at? Everywhere. Your elbow is a joint. The shoulder to the arm, the top part of your arm, that's a joint. In your finger, there's joints that make them go and bend like this. Yeah, you get it. Your ankle is a joint. Your knee is a joint. Your toes, you know, they bend and stuff like that. Those are little joints. Yeah, joints. Okay, and stuff. So then, what else you got? You got morning stiffness lasting more than an hour, greater than an hour of stiffness, when you like, oh my God, I'm dying, you know, and stuff like that. Yes, that's really a thing and stuff. Fatigue. That means not just being tired, but being more tired, like unusually more tired than tired. Everybody get tired. This is extra on top of that. This is, times 10 on top of that, already tired, and everything. And then warm, tender joints, warm, tender knee, warm, tender wrist, warm, tender elbows, and stuff. It doesn't matter wherever it's at, and everything. That's what matters and stuff. And it hurts and stuff. What do you take? Anti-inflammatory meds. One of the main ones, unless you're allergic and stuff, will be your Motrin. And then they got they got so many different ones. They got even liquid Motrin where they can just give you a shot, and stuff and put it in there. It depends on the flare and how bad it is. But also, what else? They got it's something called DMARDs, DMARDS, or MARDs. And that's immune modifying. So because it's the immune system, it's attacking itself, the immune system and stuff. It's Rosie.
I'm trying to see where I can see
it. Oh, okay, yes. Oh no, thank you and stuff. So I forgot where I was at. Oh, okay. I'm sorry. Immune modifying drugs. So this is another one. It works on your immune system and everything. And you said, don't forget the hip. The hip is a killer. I have arthritis in my left hip, looking to constant pain and going to surgery soon. My goodness, I'm gonna have to talk about post-op and pre-op surgeries and stuff. I just don't want to scare people, but you need to know what you in for, and stuff. Not that it's a bad thing. You actually fixing, helping fix on yourself and stuff. So that's a big deal and stuff. So if you are and stuff, we might have to talk. So you're gonna have to call me. But anyway, same thing with Sandra, having surgery just recently, and everything and stuff. I'm not going to say what and everything. I'll let her do that if she wants to come on and do it and stuff. But just her having surgery and stuff, and it's painful and stuff. Okay, look at this. Aquarius said my coworker had to get injections. Absolutely. Because it's almost unbearable, and stuff like that. So you have to get these, what they call steroid shots to kind of calm them down. But the steroid shots, you only could get so many and so many a year because they start breaking down that area, that they're shooting. Like if you had knee problems and you got injections from them, yeah, they solve it a little bit. No, they don't heal it. They give you a relief of pain and pressure and stuff. And so that's the problem and stuff, is they relieve the pain and pressure, but the problem is still there. You still gonna have to get that surgery ultimately, and stuff, unless, they got all these things that they're trying to do and everything. But it always, almost always, depending on how bad it's going on for and stuff, ends in a bad way, and everything and stuff. But yes, thank you, Aquaria. Thank you, Tony and Carol and Sandra and Rosie Granny Allen and Brittany and Maria. Yes, and stuff. Thank you all and stuff. Yes, you guys are doing good. That's what I like, that interaction. It makes me get through it. Huh? Oh, yes, Tony. Oh, Antoinette, you want me to say? Rosie said, call you Antoinette. Yes, Aquarius, she said, you're welcome. Thank you so much and stuff. So then after that, so you got your anti-inflammatory meds, and then you got your immune system modifying drugs. Then you got biologics and stuff. Those are different kinds of ways that they go in to try to help you with this and everything. Then there's physical therapy. Everybody feel like it don't work. It actually works if you actually pay attention to what they're telling you to do. But I fell victim of it. Don't work and stuff. We're gonna think this rubber band gonna do this and stuff. It's not gonna build up my legs and this and that and stuff, and I fuss about it and stuff. But yes, I act up too. Yes, and stuff. And then I listen. because I find out that it ain't no other way, and stuff. So I go on in there and get on down and stuff. And then there's lifestyle changes, and stuff. And that will be your diet and exercise. They actually really say when you don't move it or you're not walking, you lose that ability to walk. If you're not exercising, you lose that ability. So by the time you come back, it's like, is they trying to kill me up at Planet Fitness or whatever and stuff? I can't stand it, and everything. So yes, Pastor Carol said, yes, you have to do your strengthening exercise. You absolutely do. Or you're going to find out that it's going to be some trouble in your way. You got to cry sometime. Okay. So then the famous one, lupus, and it's called systemic lupus erythematosus. Erythematosus. Okay, I said it right the second time, but don't judge. And so, but that is a disease where the immune system attacks multiple organs, like your skin is an organ, your joints are organs, your kidney is organs, your heart is an organ, your brain is an organ. Y'all see where I'm going with this? So it attacks multiple, trying to shut them down. That's terrible. Lupus. Could you imagine what that person is feeling when they're in there and all their body is trying to shut down on them and everything and stuff when they're at their worst and everything? It looked like you going on home, I guess, to be with the Lord or something, and stuff. That's bad and everything. Oh, Pastor Carol said Tony Braxton deals with that. Lupus. Yeah, it's sneaky. And you could be pretty and still get it. You could be ugly and get it. You could be pretty and get it. But you said, yes, you have to do strength. Oh, you said that already. You have to do strengthening that. But you said Tony Braxton deals with that. Oh, my God. And stuff. And I watched that show, that little series, The Braxtons and everything, and how she be going through it, too. And it's just dragging her. And I'm like, unbreak my heart. That broke my heart knowing that she got it, and stuff like that. That's terrible. And it just breaks you down. The age group, y'all listen up. Teens to middle-aged adults. So that will start, teens start at 13 and all the way up to past 60. You can get it. Okay. And if y'all not nowhere near that and stuff, good for you. And if you are, you're probably not watching this podcast if you can't get it, you're too young or something. But anyway, and mostly women of childbearing age, that would be your 20s and 30s and even 40s, childbearing ages and stuff. Or people like me that had my son at 18 and stuff. Yep, I started a little early. I found out that things get special. But anyway, yes, Maria said my son's father has lupus. Oh, wow. And I know, I'm sorry and stuff, but I know he's dealing with it, but he gets sick sometime and stuff. It's crazy. And you said there's two types, one that attacks the organs and one that attacks the bones. Oh my God. Yes. And I did happen to look that up. So I will give you a little bit more on this after the live is over and stuff. I'm going to put something under your comment and stuff, but absolutely. Y'all see this? You can look at the questions being asked or the information being given. And if you want to know more, I address everything after the live is over. Sometimes it take me a few hours because life be lifing on me and I have some things to deal with at home and stuff. But for the most part, yes, exactly that and everything. And so, Carol put a heart by Maria Allen. Yes, and stuff. So then we got symptoms of lupus. These are some main symptoms. Extreme fatigue. Remember I said fatigue is just being a little extra tired than tired. This is tired on steroids and not in a good way. I mean, you can't even get out the bed, drag yourself to go to the bathroom. you'd rather pee in the bed, and stuff than get up. It's that bad. And then joint pain, excruciating joint pain, everything hurt. They all inflamed, all at the same time. It's killing you just touching it. The cover's touching it, somebody else touching it and stuff. You barely can bathe, it's so painful and stuff. Then it's a butterfly rash. See, I put that right there. A butterfly rash is like a mask on you, like we got masks nowadays and stuff. So that mask going right here. And it's usually, I've seen pictures, and wait till I start getting my graphics up. I'm going to really come through with you guys and stuff. But it's a whole red, like, road on a Caucasian or a lighter skinned person. You'll see this whole rosacea looking thing right here and stuff. And it's actually that lupus, SLE and everything. And then there's sun sensitivity and everything and stuff. Your skin is very sensitive to the sun, so you got to block, and eyes, you can't see and everything, so you got to have the sunglasses on and stuff. It's a trip and stuff. And then it even causes kidney problems. Now, see, Maria said when he has flare-ups, that's what they're called. When it's active, he's on steroids called prednisone. Absolutely. That's one of your number one first line of defense is the prednisone. And then after a while and stuff, when they stop working and stuff, they start, graduating to other different kinds of steroids, but it's in that family of steroids use. And then Maria said, yes, the butterfly rash, he gets that too, is right here. And it looks just like this little drawing. I tried to make it red so you could see what it is and stuff, but it goes across the nose. And they call it a butterfly effect and everything, because it looks like it goes up like this and comes down like a butterfly with the wings out, and stuff like that. And yeah, and so if that makes sense. And then you said he gets that too, and major joint pain. Absolutely, it's very painful. Only other thing I know that's just as painful as that, equal to it, but not more or less and stuff like that, is sickle cell and everything, because it affects and attacks all those joints and everything. So you're in pain. You got to get hip replacements, and at 30 and 40 years old and stuff like that, and all of that. It's real bad. It's real bad. Thank you guys for sharing and everything, because we learn together and stuff. So then you guys are my nurses together, with me on this and stuff. But we got to get the news out so people will stop being scared and get to the doctor so that they can get, seen before it's too late. And we planning a funeral. We all pour out a little liquor. You don't get none. You in the casket or in the cremation jar. Come on, y'all. Okay. So treatment for lupus is, of course, steroids, prednisone being like a number one choice, and then eventually they probably have other things and stuff. Immunosuppressants, to stop fighting the immune system. You being messy, you acting up, and stuff like that. So they got that one. And then they got anti-malarials and stuff, like malaria, you think of, some exotic place where they got malaria in the forest or something like that and stuff. But that type of medicine, that's what they use to help treat it. Protection, SPF 50, 60, 70, 80, 90 or whatever and stuff, covering your skin up and everything and stuff from the sun and those UV rays and stuff like that. And then a regular monitoring, because it's going to cause some trouble. Welcome on in, Michelle. Yes, you said rheumatoid arthritis too. Yes, I just did that one and everything. No worries and stuff. But yes, I did rheumatoid arthritis first and stuff. So yes, it's really a thing. That was the first one I saw on there, and everybody be like, my arthritis hurting and everything because my hip bone connected to my whatever bone and all of that stuff. Your elbows, your shoulder, your ankles, everywhere can get it if you're a human being. Yes. And then Pastor Carol said some of the treatments for sickle cell has the extended has extended the lifespan. Absolutely, because they were going, passing away from sickle cell at, like maybe, in their early teens and stuff, 12, 13 years old, sometimes even earlier than that and stuff. This is hard and stuff. It's not about them being able to take all that pain medicine, their threshold being high. It's about what the disease is doing itself to your body. Anywhere that is too much inflammation for too long, it's a problem. And the inflammation is your body, your white blood cells going to fight what they consider a foreign body. So that they're at war. That's why I feel like it's war in your knee, it's war in your hip, it's war in your elbow, and all these different places. It's terrible and everything. Miss Sandra said, do the red cells and white cells have anything to do with lupus? Yes, cells in general and everything. So all of them and everything, and they're all in danger and everything. So white cells because they come, but red cells because that's what carries the oxygen and nutrients into your body, into your, into your veins and everything, into every part of your body to help it function. So everything is at risk, everything. And then Pastor Carol said rheumatoid arthritis can cause lymphedema too from the swelling. Yes. And that's when it gets extra big. Like say you got just rheumatoid arthritis in that one leg. You're going to notice a difference because it's going to be bigger, redder, hotter, and everything else than the other leg. So you already know, man. And you said, I hope I spelled that right. Yes. Or at least it looks about right and everything. That's fine and stuff. So lymphedema, which is your lymph nodes, that's your immune system, and edema meaning, that swelling, and stuff. If everybody, a lot of people ankles swell. I got edema in my ankles, and stuff like that. That's where that comes from, that term and stuff. But it's swelling, a collection of fluid in that area. That's why you got to always elevate when you get any swelling or edema in your legs and feet and stuff like that. But these are all really good ones for you guys and stuff. And so there is another one called multiple sclerosis. I don't know if anybody has ever heard of that. Oh, Rosie Granny Allen said, you talking now, fire, teach. All right. Yes, that fire, it be burning and everything and stuff. So multiple sclerosis is an autoimmune disease that attacks the protective covering of your nerves in the brain and spinal cord. Leave my brain and my spinal cord alone. What's wrong with y'all? And stuff like that. But when it says that and stuff, you got a spinal cord, not your spine, that bones and stuff like that. Inside those bones, your cord goes in there, and so it needs to be protected. So there's a sheathing around it and stuff that needs to be protected from even your bones and everything and stuff. And so your spinal cord is your command center. So if it gets damaged or it gets in there and attacks the sheathing, it exposes you. It can kill you, and stuff. It's bad. It's bad and stuff. They have things that they are doing for it, and I'll get to that in a minute and stuff. But that's the covering. Also, your brain has nerves all through it. It's a nerve center. It's your think tank, I said that, but also your nerve center. It's the thing that makes everything do what it do, and everything. That's why if you have a stroke and it's damage on this side, it tears up this side, and stuff, the opposite side and stuff. That's where all of this is coming from and stuff. And if it's eaten at the protective sheathing around it, that's a problem. But that's what happens with multiple sclerosis. And so Aquarius said, Carol, that's a good tip. I'm dealing with swelling. Absolutely. And then also Pastor Carol said, LOL, me and Aquarius kindergarten teacher from back in the day had that Miss Thomas. And kindergarten, Miss Thomas, Yeah, probably and stuff. Yeah, we all elementary school friends and stuff. Oh, that's so sweet. But yes, and stuff. So um the age group for multiple sclerosis, 20 to 40-year old. Y'all see it's getting lower because it's attacking the youngsters. I call them the youngsters. Me, I'm a youngster and stuff like that. But yes, and it says it's more common in women. But men, watch out, you can get it too. You're a human being at the end of the day. And Aquarius said Whittier Elementary in Oakland, California. Yes. Yes. And Pastor Carol said, yes, she taught us about multiple school. Oh, okay. Did she have it, Miss Thomas? Well, maybe you can answer that. If you can, it's okay. And stuff. But the symptoms of it is vision problems. So it's messing with your eyes, period. So that's why you got to wear the sunglasses and things like that when you go out. You got to be protective. And then it muscle weakness, and then numbness and tingling. That's that little pins and needles in the tips of your fingers, your feet, and different things like that. It's a problem. And then fatigue. Fatigue is not tired, but more than tired times 10. And if it's even worse than that, then it's times 100. It's terrible. And oh, you said Aquarius said pretty much everything attacks all age range. Absolutely. I know she's a kid. She's so young. It doesn't matter and stuff. It really don't matter and stuff. It's attacking all of us. I like to put the age groups because I don't want to count nobody out, because when you're looking at your child and they might be 16, 17, 18, 20, 30, or years old or something like that, you want to be able to be mindful of that, because even though it might not be attacking you, it could be attacking your kid. Or if you had some, if it was in the family or ran in the family or something like that, because genetics is one of the big reasons for you to possibly get any of these and everything. And then also this multiple sclerosis it causes muscle vision problems, muscle weakness. You can't even barely stand, to get yourself out the bed and everything. And then there's numbness and tingling. There's balance issues. There's that fatigue, more than just being tired. And a treatment is disease modifying, meaning they tailor it to your symptoms and this actual disease. And that's the line of defense they got for you. Then there's steroids during a flare up, like one steroid everybody has heard of, and that's prednisone, but they got a whole class of them. So if this one don't work, then they try another one and another one and stuff. So, that's where that comes in. And then physical and occupational therapy. So occupational is the brushing of your teeth, to being able to be independent, to feed yourself and stuff like that. Physical therapy is actually lifting them legs and strengthening exercise like Pastor Carol was talking about and stuff, and doing that type of work and everything, and moving and walking and exercising, period. Not running a marathon and all of that type of stuff, but I'm talking about just regular, good old fashioned exercise daily. Well, we know I'm at home and not in my office, but anyway, and stuff. So there's also I want to talk about one that I want to say, and that is the differences, because psoriasis is one of the illnesses, that's a autoimmune disease and everything, and psoriasis is, but you notice that eczema is kind of like psoriasis, and stuff like that. So I'm just going to explain it and everything and stuff. The appearance: eczema causes thin, dry, scaly, or sometimes oozing, weeping skin. Psoriasis appears as a thick, raised red plaque with a silvery white, dry scale and stuff. So that's the kind of difference and stuff. I know that sounds like a lot of words and everything, but what I'm trying to say is They're not the same. Psoriasis is psoriasis, and that's an autoimmune disease. Eczema is a different kind of skin disease and stuff, and that one does what it does and everything. Welcome on in, my brother Jason. And so he said, great topic. Yes, thank you so much and everything. So that's where that comes in at. And then another thing about uh eczema and psoriasis, itch intensity. Um, Eczema typically causes intense itching or unrelenting itching, and it often causes the itch that causes the rashes to appear on you and stuff. Psoriasis causes itching, but is often accompanied by stinging and burning sensation. So they both hurt. That's the biggest, thing of them. The location, eczema commonly appears in the folds of the skin, like under on women under their breasts, in their inside their elbows for men and women and stuff like that. It could be behind the knees and stuff like that, or sometimes you just see it flat out on the arms or something, or hands even and stuff. And so those are the places they be hitting hard on and stuff like that. So it's troublesome, either one of them. But the reason why I want to pick these is because I want you to know the difference between them and everything. And the triggers, psoriasis is usually outside of a joint somewhere and stuff, and it looks ugly and until it goes away. And you know what I found out, the reason why I even paid attention to psoriasis, I believe this is what Kim Kardashian has. And she's all beautiful and made up, all gorgeous and everything and stuff like that, but she gets flare-ups, and that's when they come on and they disfigure her, temporarily, but they do and stuff. And then she, of course, she could pay for the best doctors and everything to keep them, the flare-ups at a minimum, but they still gonna happen and everything. She can't just get rid of them. It's in her DNA and everything and stuff. So the location for psoriasis usually appears on the outside of joints, like elbows, knees, the scalp, the lower back, and the nails, around the nail beds and everything. And the triggers for eczema flares is usually some type of environmental cause, and everything. But also the bacteria, when you're overweight, by some, it doesn't matter how much and stuff, but those folds in that skin and stuff, that's when you really find out what it does and everything and stuff. So you got to keep things dry, and things that don't see the sun, that when you go outside they not seeing the sun, they get shade all the time where it's hot and murky. Your sweat is actually released to stabilize your temperature, but it's also bacteria. So the sweat is a waste product and stuff, so it has bacteria in it and stuff. So if you don't wash it off by showering and cleaning it up and stuff like that, that sweat sits there and then it accumulates with more, and stuff like that, and it causes a problem and stuff. So that's where that condition comes in at and stuff. So another one that I wanted to talk about, that was psoriasis, but I added eczema to that just to let you know the differences. And so the other one that I wanted to do, and I'll stop on these naming these things, is the Graves' disease. And it is a chronic autoimmune disorder where the immune system attacks the thyroid. And I told you the thyroid is in the neck, like on my little pictures and stuff, that little doggy bone right there and right there on the neck and stuff. And that will be the Graves' disease. And let me see, causing it to overproduce or be, it's called hyperthyroidism and everything. So it is most common cause of hyperthyroidism, often causing symptoms like rapid heartbeat, weight loss, anxiety, and tremors. It's 7 to 8 times more common in women than in men. And it also features another thing called a Graves ophthalmopathy. I can't pronounce it. Eye disease and everything. I couldn't pronounce that for nothing in the world. And I said it a couple times. I tried to practice it. But anyway, the whole point I'm trying to make of that one is this is all common with grave disease. So it causes the eye problems, which is a big thing and stuff, because it can cause blindness even and stuff. And it causes the eyes to protrude, or kind of bubble out and stuff. It's not somebody doing that on purpose. It's because they got Graves' disease, most likely, and everything and stuff. And it's very dangerous, and it's definitely life threatening. It's a medical emergency and stuff, and it's an autoimmune disease when the body attacks itself. So that's the biggest thing and stuff is that. But some of the key symptoms is the hyperthyroidism, which causes the rapid irregular heartbeat, sweating, tremors, anxiety, insomnia, and unexplained weight loss, to be exact. And then the eye disease, which I said Graves, ophthalmopathy. Ophthalmopathy. Yeah. Say it 10 times and see if you can pronounce it. But anyway, it occurs in 30 to 50% of the patients with Graves' disease, and it causes bulging eyes and redness and inflammation. It's a problem. It's a medical emergency. Also, another thing with Graves' disease is you can get a goiter. That means your thyroid, which is here where the man's Adam apple is kind of below there, but it's the thyroid gland that's right there and stuff. And in women, we don't have an Adam's apple, but everybody has a thyroid, and it causes it to swell and enlarge and everything. And that's bad and stuff, because they may have to take out your thyroid itself and everything. Then also skin changes. It can cause thick red skin on the shins or the feet and stuff. And that's a whole problem. So saying all of that and stuff, because I wanted to give y'all some real live things that's going on with us today, and stuff like that. It might not be you, but it's going to be somebody. And remember, I said it's over 100. I just gave you about 6 or 7 of them and stuff. But could you imagine that? So at any time we can get them. And they said they don't even have a real reason why. They said they got common things why. If it runs in the family, it's genetics. It's environmental sometimes. It's physical or emotional and stuff sometimes. So you just don't know, but don't write it off, And one more I just wanted to mention, and that is your inflammatory bowel disease, IBD, or Crohn's disease, if anybody's heard of that, or ulcerative colitis and stuff, if you've ever heard of that and stuff. They're all the same thing and stuff, IBD and stuff. And that's the autoimmune inflammation of the digestive tract. You mean my stomach, my eating thing, my gut? Yes, your gut. And guess what? Everybody got a gut, no matter what, and everything and stuff. So it tears it up. And the age group, teens and young adults, that's who get it. As soon as they eat something and stuff, they running straight to the bathroom and dumping. And it's fiery, sometimes even bloody diarrhea and stuff. It's horrible. Okay. Pastor Carol says she's joining her Bible class. She'll see me next week and everything. Thank you so much. Make sure to watch the replay, Pastor Carol, and stuff. It's some good stuff, And if you want some of your questions answered and stuff, come on back and everything. But thank you for coming in and thank you for participating. All right. And then what else did I want to say? Yeah. So I want to get to that. So I'm gonna finish off with yes, I got a few minutes and stuff. I'm gonna finish off with myth versus facts. Then I'm gonna give you a little take-home message and everything and stuff, and then we're good to go tonight. And that would be myth. Autoimmune diseases are rare. That's a myth. The fact is, millions of people are affected worldwide, everywhere. Okay, Rosie Granny Allen said, Nurse Allen, this title says it all. Real talk. Amen. That's right. And yes, that's right, mommy. I love you. Myth. It's all in your head. That's mean. And stuff. We know it's a myth though. The fact is autoimmune diseases are real, measurable medical conditions. They are real. Rheumatoid arthritis, lupus, multiple sclerosis, just to say a few and stuff. So then myth. Only older people get autoimmune diseases. We know that's a lie, but okay, it's a myth. Fact. They occur at any age, including childhood. So just in case Aquarius on, yes, they can hit at any age. Yes, you were right for that and stuff. And then another one, myth. Nothing can be done. So nothing can be done. Just don't do nothing. That's how you got this in this situation in the first place. Nothing can be done. How you know? Did you talk to your body? Did you listen? Okay. And stuff. Because the fact is, early diagnosis and treatment can slow the progression and improve your quality of life so that you're not suffering and suffering. They just gonna give me some bad news. You already got bad news. You got it and stuff. So they can't give you no more, but they probably can help you. So that all that time you've been laying in the bed because you can't even, it's so debilitating and stuff. You could have been up moving and still getting to the park and going to a concert or doing something, worthwhile with your life. You only get one you. Okay. And stuff. So I'm gonna do my take home message and I'm almost done, you guys. Thank you guys for hanging in there with me. Everybody that could and stuff, I appreciate it. Everybody that couldn't, I appreciate you too. And just make sure you watch the replay. I'm streaming from Facebook Live and YouTube at the same time right now, simultaneously. And on Facebook Live, I'm under Charlene Nurse Allen, and everybody know me from that and stuff. And then also on YouTube, I'm under Medical Talk in Layman's Terms with Nurse Charlene. There's only one of me there with that title, that long title and everything. That's how you got to keep your passwords like that so people won't break in on your stuff. But anyway, the long story short is definitely I appreciate you. And sometimes when you ask that one question, you're being therapeutic to somebody else that's on watching but don't want to say anything and stuff. So you go ahead and live your truth. You get your information because you're going to be able to help a lot of people with that and everything and stuff. So yes. And Rosie Granny Ellis said, just pray, okay? Amen. But also you got to be in the know. When you're not in the know, you find out, yeah, my life is over because there's nothing we can do about it at this point. I'm going to give you such and such to live. Or, you've been dragged all this time in the prime of your life and stuff like that and stuff. Go ahead and find out and tell on it so that you can get it fixed and you might have a better, outcome on your life. Your ending might be better than your beginning, and stuff until you go home to meet your maker, whatever that looks like and everything and stuff. If you tell on it, you got to get to that point where you're not afraid. Live your best life. Remember, the doctor don't know you. So guess what? If you don't tell him nothing, he ain't gonna tell you nothing. Just or she, because it could be a she doctor and everything, or a he doctor, nurse, whatever, and stuff like that. If you don't say and express yourself, they gonna still get their check. If you went to the doctor's office and you found out nothing that you needed to know or something, you don't have no resource on how to find out what is the potassium, what is the calcium level, what do I need phosphorus for, and stuff. You gotta tell, you guys, you gotta tell. So Cousin Tony said, thank you, cuz, as always, good information. I appreciate that. And Miss Aquarius said, good night and thank you for all the knowledge, Nurse Allen. good night, and thank you for coming on and joining. And definitely, after this is over, you could watch on your own time. You could watch the replay so you could get from the beginning to now and everything. But I appreciate you. And Jason said anti-inflammatory indicators, absolutely, and stuff. Is that something you want me to talk on? Yes, and stuff. Let me know. Give me the word and go ahead and release me and stuff. So yes, thank you, Jason. That's my brother and everything. So I'm just ending with the take home message, and then I'm getting off in 2 minutes, you guys. Thank you, Maria. She said thank you and stuff. I appreciate you, and I'm glad you came on and stuff, and I appreciate every participation you did and everything. So this is the key to it. And so that is autoimmune disease occurs when the immune system loses its ability to recognize itself. They are chronic but manageable. Chronic but manageable. Not this, there's no more we can do for you. Nothing else we can do for you and stuff. Chronic but manageable. Early diagnosis is critical so that your quality of life is better and everything. So then we have symptoms are often invisible but life altering. They're invisible, but they gonna change your life, because you gonna figure out that, yeah, when I can't even drag myself out of the bed, if anybody touches me, I scream to the top of my lungs and stuff. That's probably a problem. And this is man or woman and everything. Treatment focuses on controlling inflammation, reducing flare-ups, and protecting organs. Okay. Lifestyle, stress management, and medical care work together. Let me repeat that. Lifestyle, stress management, lifestyle, diet and exercise and everything. That's your lifestyle. And then stress management, because we all have stress. There's nobody exempt. Even kids have some stress. You know, it's a bully at school or something, they got stress. And medical care work together in unison to give you a better you. And then final thought. Your body is not betraying you. It's signaling that something is wrong. Believe it. I want to say that one more time. Your body is not betraying you. It's signaling that something is wrong. Believe it. Listen to your body. It's in there, and then it comes out and tells you in the form of a symptom and everything. So that's very important. And cousin Tony said, yes, we always have to be our best advocator for ourselves. When we go into the doctors, advocate for yourself. It's very important. Ask questions. Don't be afraid. That's what they get paid for. I just added that. The most stupidest question is the one that you don't ask. You know, and stuff. And the reason why it's stupid, because you never even gave it to them. That might be the one key they were looking for when they were listening to you and you told them about yourself. And remember, doctors and nurses, they are not nosy. They're asking you because it could be somebody else that had this and stuff. And so they know where to go with it and everything. But it's the fastest route to, the more information you give to them and don't withhold, the more information and the faster your recovery can be. It's when you don't give that information, that one little thing. Oh, it's stupid. They don't want to know about that. How do you know? Tell them. And you know what? They don't get to use it against you or call the police on you or do anything like that. They got to use it to fix you. Because remember, they don't know you. What they gonna do? They don't have no skin in the game with you. That's your life. It doesn't matter and stuff. Tell them. That's all I'm gonna say. All right. Thank you guys for coming on. I appreciate each and every one of you. Your wonderful questions, your wonderful answers, your wonderful information. I appreciate your bravery, and anybody out there that wasn't ready to ask a question yet, and everything, but you're getting there and stuff. It's okay and stuff. And I promise this is a, what would I say, judgment free zone. We don't judge anybody, and we talk to everybody. I like to be transparent. I will tell on myself in a minute. Hate it or love it, I'm still a nurse, at the end of the day. So you can't take that from me. But the long story short of it is this is serious. But I do like to keep it lighthearted. I tend to joke sometime and stuff, but I know how to get serious and reel you back in and let you know it is a medical emergency. An autoimmune disease is definitely one of your medical emergencies and everything. I appreciate you guys. Oh, Auntie Josie, you watched the replay. She said, I'm here and stuff. Watch the replay, Auntie, and stuff. I'm about to get off and stuff, but no worries. You watch the replay. Next week, we'll get back on and we could go at it together, and stuff. You know how we do it and stuff. And Michelle, my sweet Michelle, she said, thank you. I appreciate you. Thank you for coming on. And my cousin Tony said, thank you, cuz. Good information as always. I appreciate that. And Auntie Josie said, I will. Yes. You guys rock. I'm telling you, y'all give me so much energy and stuff. Forgive me if sometimes I can't pronounce the word. It's a whole bunch of medicines I can't pronounce either. But just take it. And so that's why I'll be going by, do you want Tylenol or do you want acetaminophen? Which one you want? You see what I'm saying and stuff. So I get tongue tied and stuff, but I'm not afraid to admit it. That don't stop me from knowing what I know and stuff. So at the end of the day, you guys, y'all hang in there and stuff, because I got so much good stuff. And possibly next Tuesday, I will have a guest speaker. And so I'll do the spoiler alert online and stuff when I advertise again and everything. But I got somebody coming on for my first guest, live and everything. And we're going to talk about, we haven't all the way discussed which part of the topic we're going to talk about. So I don't want to give you that part, but just letting you know, I'm going to have some guests on. And y'all get ready. Anybody that want to get on and stuff, because we're going to get on down. Maria said, that's all of us, Nurse Allen. And wait, no, you said nurse. All of the chemical terms, they're hard to pronounce. Absolutely. It's either Motrin, and Motrin sound pretty easy, or ibuprofen. You see what I'm saying? It's like, yeah, NSAIDs and so and everything. But I try to do my best to give you some medical terminology so that you come out of this, you're going to come out a little bit heavier as far as on your knowledge of the medical stuff, and everything. And that's all I'm trying to do. It's time for us to talk to our doctors. All of us. It's time to talk to the doctors and tell on it. It's telling on us. Why don't we do our job and tell on it? And guess what? You might just live to see another day, another year, another decade, and so on and so forth. Take care, you guys. And yeah, that's it. I feel so. And I missed y'all last week. I know I couldn't come on. I had a medical emergency because life be lifing and everything. But we here now and everything is good. All right. Take care, y'all. Yes.